you're going to have these two models, one with every other teeth, one with all teeth designed. You're going to take a clear impression of both models. On the right side of this, you'll have both of your impressions. Push it all the way down. Make sure that you get some of that clear goo up on the gums so that you can have an anchor point when you are placing this, placing the product on the teeth. And remember, when you punch it through, and you can use the tip of your flowable to push through there. Remember to remove, there'll be some matrix that comes out. You can see in this little video when you punch it through. And now you've got that little goober in there. Make sure you take that goober out, okay? Prepare your big teeth. Remember, if you are gonna do a little removable of some like previously existing composite that's like discolored and gnarly, get that off of there. And if it helps you, put a little, like I keep lead pencil in my kit all the time so that I can like draw line angles and make sure that I'm getting things looking the way I want them to. X your teeth and do your adjustments as needed. If you're like, I've got to take off this bit of composite, and I try to do that on the model to demonstrate that. Next, you're going to prepare for bonding. But if you air braid your enamel prior to etching it, it just opens up those tubules even more and drastically increases your bond strength. I don't bond anything. I don't bond veneers. I don't bond composite. I don't put a crown on without air abrasion. So you'll air braid. And if you're new to air abrasion, remember to point the air abrasion flow away from the soft tissue and towards the incisal edge, because if you point it at the tissues, it will cause the tissue to bleed. Once you rinse all of that, aluminum particle, whatever, off of there, etch your teeth for 15 seconds and then agitate as you're etching it, and then thoroughly rinse that off. Then you'll want to put Teflon tape on the teeth that you are not injecting, and then grab a new little container of the Future Bond. You rub it in for 20 seconds. And remember, rubbing it in as you're doing it. If you are drying your bond, remember to air dry towards the tissue. That way you're blowing the bond down into the sulcus and in there versus like blowing any possible moisture onto your tooth. And then light cure it for 10 seconds. And then this is just an article I quick threw in here half hour before we did this that showed that the air abrasion and acid etch combined increases your adhesion. Then you're going to go and inject your flowable composite. So everything's all bonded, ready to go. You're going to seat your matrix onto your patient, and you're going to take your flowable tip and take it all the way down to the gingiva. Use your thumb to press pretty firmly on the patient's soft tissue so that it doesn't squirt out all over the place, and then slowly, inject it as you're bringing it out.